Our programs are here to help people live their healthiest life.
I like it here. I love people, I love being around people, I love helping people. I love changing people's lives by teaching them things that they didn't know. To know that you could help, facilitate, and be a part of changing someone's life in such a drastic way and making that difference absolutely beats any other job.
Surry County really offers so much resources for the patients and for the people in the community.
We want to help them succeed in their goals. We want to help them, get the nutrition that they need to live healthier lives. I mean, that we're here. I think that's the biggest thing, is that people don't know that we have these programs available for them, and so they may be, not getting enough food each month or each week, or their child may not be getting enough food. And so I think it's just really important that people know that we're here for them.
And so when I talk about these programs, when I talk about my staff, these are lives, these are real people. I've watched community members that had nothing go back, get a college degree, and support their family and bring their children back here.
You won't find a better group of nurses, a better group of providers than what you'll find here at the health department that truly, truly care about the people that they serve. And it's not about us, truly, it's not. It's about them.
I have the pleasure of being the health director of the Surry County Health and Nutrition Center, which is a public health agency. So oftentimes when someone hears public health, they really don't know what we do. I often describe public health as a silent miracle, that unless something goes wrong, you have no idea that it's going on. So if you go out to eat at a restaurant and you want your food safe, that's public health. Every time you flush your commode and things work properly and go, that's public health.
And with that, we look at keeping sewage off the ground, making sure people have safe well water to drink, and making sure that any food that they buy or places that they stay are safe to eat and safe to stay in. We also don't want to forget pools and tattoos. Any public swimming pool we inspect to make sure that everything is working right, and also any tattoo parlor. Make sure that the tattoo parlor itself is permitted and each artist that works in there is permitted.
Whenever you need child care, dental, when you want to make sure that the dog walking in the park is safe, rabies control, those types of things, that's public health. And so oftentimes, like I said, if things are going great, you don't hear about us. We're kind of silent. People just assume things are going okay, but if something goes wrong, if a pandemic hits, if people have complications and they need resources for indigent care, or they're just not sure who to call, oftentimes they call us. I believe in what we do. I believe the effects of what we do. I believe there's long-term effects for the community, and anything that helps my community grow and be healthy is good for all of us, not just one person.
It goes far beyond the walls that we are in here, and my goal for us as an agency was to get outside of these four walls and take what we do to the community that we serve. So we've done that by multiple vaccine clinics in different locations. We've partnered with our school systems. They allow us to come on site and do flu vaccines. We do sports physicals free of charge in all the school districts. When I started this, we were just in one, and now we're in all three school districts. So those athletes that want to try out for sports or that want to play a sport, our providers and nurses go into those schools every year and do those physicals free of charge, so that parents don't have to take off work to bring their kids to appointments. They don't have to pay for them. That's just one of the many services that we provide. We have a mobile trailer that we take to businesses. So just being able to meet people where they are, closer to their home and where they live, whether that's Pilot Mountain, Elkin, Mount Airy. It's not just a place people come and get their immunizations. It's not just a place for the uninsured. We accept private insurance. We do self-pay on a sliding fee scale. Our primary care clinic, we take new patients. You don't have to be a resident of Surry County to reap the benefits of our clinical services. I think that the services we provide are top-notch. I think our providers are the experts in the area. We have many other private providers that lean on us for the education and the information. We have substance abuse programs that we do here. We have hepatitis C treatment here. I mean, we're that one-stop shop, behavioral health services, immunizations, child health. We do breast and cervical cancer screening. So if you need a mammogram and you can't afford it, like we are your place. That's what our staff are very passionate about, the community in which they serve. They don't come here for the money. They come here to truly be servants of the community.
We have a diabetes program that initiated in Surry County and was replicated throughout the state on many different functions. It's not been our only. We've had several that have started in Surry County. We are not scared to think outside of the box. If it's a gap that my community has and they need it, then we try to find some way to bring it here to help our citizens.
I'm a part of a really big team of employees that work really, really, really hard, and they have a passion for what they do, which matters. It matters a lot. And so when that it's not just a job to them, it's a passion that they care for each and every day, and the families that they provide services for almost become a little bit of a part of their family.
Our nearest clinic that has anything of the capacity that we have is in Winston. Here we have classes with diabetes, we have certified diabetes educators, RDs. Another thing I'm very proud about is that we have behavioral health in our doors. We have an ADHD clinic, so if we have a child that needs help, they don't have to go to somewhere else for their behavioral health needs. We can take care of those. We offer holistic care, so dental services, services for mom, services for dad, services for the kids. We have it all right here.
So holistic means kind of looking at the patient as a whole. So from top to bottom, we encompass mental health care, their physical health and well-being. So not just focusing on high blood pressure and your diabetes, but your mental health, your behavioral health, anxiety, depression. Just looking at the patient as a whole, as one big picture, and not focusing on the tiny little bits and pieces of that patient. And that's what we do here. We have integrated behavioral health. So if you come to us, and yes, we talk about your diabetes and your high blood pressure, but if there is that underlying anxiety and depression driving the high blood pressure, or your social determinants of health, you can't afford food, or healthy food. Healthy food is expensive. We have means, to go at it from that angle and figure out how we can help you afford these foods. So it's just kind of taking the entire picture into account and not just kind of face value of the patient.
But I've heard so many people have no clue about our services. So many people don't know anything about that we have a dental clinic or a pediatric clinic that's ran like a private practice. We have so many services within our building right now, this building, that folks don't know about. So we accept insurance, we accept folks that are self-pay, that can't afford insurance. We put them on a sliding fee scale depending on their income, so it's so affordable. Tons of resources here if people would just take advantage of it.
So there's all walks of life that use our services. And it doesn't just have to be those with low income. I'm so proud of my dental clinic, my pediatric clinic, my diabetes clinic, that they have people that they have seen since they were young, that grew up, had children, and they come back to us. I like to consider us part of the culture here in Surry County because that small town feeling, we care about each and every person. We want to do our best for each and every person. And if there's people in my community that need a service, we try to bring it to them in the best manner that we can. Bringing in new ideas. Every year my group goes through a strategic plan in which we try to think about things that we could offer to our county's citizens, things that would improve our services. And if it's a dream, we don't say no, we say how do we get there? What do we need to do? What do we need to do to bring that to our citizens? And so if there's a barrier, let's find a way to go over it. Let's find a way to accomplish it. Let's do our best for the people that we serve.
Yes, I love my job. Yes, I'm the money person. The money person has to prepare the budget that goes before the board, that the board has to approve so that we can function and offer the services to the community.
The one thing nice about the staff is that they want to be here. They're passionate about what they do. They are full of pride of each clinic that they offer. And so they want to be the best because our citizens deserve the best. We have people that have been with us for years. We have people that have been in large hospitals and choose to be here so they can have more time with the patients, so they can make a difference. Because seeing that person come in and just leave one time isn't enough. It's because we want to be part of who they are. We want to see them succeed, and we want to be part of their community where if they need help, or a family member needs help, or a neighbor needs help, they know who to refer that person to. We have multiple services, and depending upon the need. So if you're wanting primary care, if you're needing pediatric services, if you're needing dental services, if you're wanting screenings for different kind of communicable diseases, immunizations, diabetes, medical nutrition therapy, the WIC program, behavioral health, and the list continues. So there's not a whole lot that we don't offer in our clinic setting. But we have a whole nother area that is not clinic-based. We have our health educators, we have environmental health, we have those that go out into the community that constantly do community programs. And I think that too is something that the community does not know a lot about. We're in our school systems, but local civic groups, work site wellness, we can also get into our community in a different setting besides clinical, because in public health, it doesn't hold us to inside walls. We can intermingle within our community to be a part of the community, and however our community members need us to be there.
The BCEP is the Breast Cervical Cancer Control Program. Yeah. And it's just there, you know, for the taking. For so many people that don't have insurance, that need mammograms, that need Pap smears.
Part of public health is the nutrition component, and some public health departments do not have a robust program like we do. So I'm excited to say that not only do we do the Women, Infants, and Children's program, but we do medical nutrition therapy, where we have a registered dietitian and a certified diabetes educator. So whether someone has diabetes or they have another nutritional need, we can help them take care of that. Offer nutrition programs out into the communities. We try to really work strongly with our school settings to promote nutrition within our schools and our young folks, because obesity, diabetes, those types of things are on the rise.
If you come here for your services, you're not going to be disappointed. You're going to get excellent care. You're going to be treated fairly and equally, no matter what socioeconomic level that you're in. We treat everyone the same.
So that's definitely on our radar as one thing we want to make sure we have services to assist with and out there educating people about. And public health solves problems. That's what we do. And having that ability, having no barriers in solving that problem is amazing to me. So I'm blessed to have on staff people that think the same way. Like, there's a problem here, how do we solve it? What do we need to do? What can we bring to the table? And whether that's connecting with others in our community, whether that's a program that we develop, we try to make sure that we fill in those gaps and we bring that need to Surry County.
And to know that you can reach out for help and not be met with someone that will necessarily judge you or not understand where you're coming from, but know that there are people that are available that can help walk you through situations and try to help you meet the needs that happen that are sometimes beyond your control and something that you can't help.
The passion for what I do, people that I serve, my staff, give me the energy that I need to come to work every day to try to make a difference for the people in Surry County.
I have to audit every program, and I really cannot pick just one. It's across the board. Everyone really desires to do a great job, and they really care for people in a way that I've not seen even in the private practice world. I've just seen that here.
Truly, there's no discrimination, no matter your income level, no matter what language you speak, no matter who you are in your walk of life. We have a program that will touch you.
I would suggest for people to not feel discouraged and not feel, if there's a need present, whatever the need is, I think it's important for them to reach out. And I would encourage people of all ages, of all sorts, to reach out if you have some type of need, instead of thinking that you're alone and that that need is not fixable, because odds are it just may be. So it may be if a family needs food, then we're going to send them to the food bank to get that food. If they need help with their power bill or medications or something like that, we're going to send them to another resource to find help for medications or a power bill or something like that.
I'd like to reduce the stigma around what a health department is. I'd like for them to see that we do provide that holistic approach to care, that we're here for anybody in the community. They can come get their flu shot, they can get a COVID booster, they can see a provider for high blood pressure, they can receive family planning services, they can bring their children here, that we want to take care of them as a person and their families, and just make sure that we protect them and educate them to the best of our abilities.
One, we have a provider on-call number where anyone can call. So the providers take turns being on call for the weekend, and anybody can call them if they have the provider on-call number. So we have implemented this to hopefully help decrease the number of emergency room visits during the weekend. And we also have a provider on-call visit, so those that speak Spanish, they can call, or the provider will call the interpreter on call, and then they're able to communicate with them. And their primary objective is the patient. So if a patient's in the clinic and a provider pages for an interpreter, that's their main focus. That's where they're going in order to one, limit the wait times, but then also kind of navigate that language barrier between the provider and the patient. I think the patient experience that we have does make it easy for patients to come, but then on the other hand too, we do serve a majority Medicaid patient base, so these are services that the patient gets, and there are a lot of agencies within Surry County now who don't take Medicaid, doctor's offices, or they only take a certain number of the prepaid health plans that North Carolina has put into place. So as of right now, we do take all major insurances, so we do have a lot of patients who couldn't be seen elsewhere who come to us.
So many of our programs have 0 qualifications. You're a Surry County resident, come and give us a call. Let us see what we can do for you. I love this place and I love what we do, and I believe in it.